And we are live. George Gore is in the house.
Woo, 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 woo.
How you doing, George?
I'm good, thank you. How are you doing?
Good. I'm all right. So, the viewers who tune in a lot more than others, you'll see we are in a different venue. It is still Ash, but we got here an hour ago, and the changing room the roof has come down. That's the best way to say that.
Roof has collapsed.
There is water coming through, so we've had to move it to here. As you know, some of you know my OCD and ADHD. I do not deal well with change. So I've been freaking out the last hour or so. We are not expecting anyone to come through the doors to where we are, okay? But if they do, we'll continue through it. So if you hear a noise and you watch our heads turn, that will be me or Danny freaking out, okay?
Yeah.
But apart from that, George, good to have you here.
Thank you.
So we're going to speak to George about his physiotherapy sessions, his time at Southampton, and very much so the new football rehab clinic that he's opening up with women in the forefront. So let's get straight into this. George, how did you get into sports therapy? What was the journey? Tell us all about that.
So for me, it actually started when I was around about 13 years old. So played football from a young age, obviously, as a lot of us have. And then I was watching a game on TV, FA Cup game, it was at the time.
What game was it?
And it was Man U versus Leeds, I believe. I think it was Man U Leeds when Alan Smith broke his leg.
Alan Smith broke his leg, yeah.
I think it was Man U Leeds. And he broke his leg. So at the time, obviously it's different these days, but at the time they showed everything, didn't they? So when he broke his leg, the physio's on there dealing with it. And I went from wanting to be a footballer, wasn't quite good enough.
See on knees.
Always the knees.
And then I decided that from that point onwards, all I wanted to be was a football physio. That was it. So that was my drive from 13 years old. So I actually started learning and studying from that age, and then went to university, and I was lucky enough to get a position at Southampton quite young.
Okay.
So I was 19 at the time when I went there, working with the academy boys. And then from there went part-time into two different football clubs. One was Andover and one was Sparshall College, but they both had affiliation links to Southampton.
Yeah.
But regards to the career, vital, because at the highest level of football, you learn things that you wouldn't learn anywhere else.
So we're going to be speaking about that as well, because I've got so many questions from the time at Southampton.
Yeah.
I was doing a bit of Googling, and I was like, here we go. I've got some good questions here. But follow on from that.
So that basically shaped my career with regards to the private practice as well. So having done that, with regards to the football environment as a whole, loved it, but not for me personality-wise, because I'm not a massively big character, which a lot of the time it's easier if you are in a football setting to be that big character. I'm more of an introvert, so I wanted to go into private practice and bring everything I learned from that high level into grassroots. So that was the plan, but I couldn't do it off the bat. You can't just go from your football to having a massive client base. So I had to build that over time, and I've started to shape that into the direction I wanted to go into, which is the grassroots football, and build out from there to give everyone the same experience they get in an academy setting.
How long has that taken to build it?
So overall, I'm on my 12th year.
That's good.
But full-time, 7th year. So it hasn't been... So football was always there. I was always doing bits and pieces of both the whole way through. But overall, it's a 12-year process to get to where we are now, and obviously then ready to go into the performance centre and then build again from there.
So going back to the Alan Smith injury.
Yeah.
If that didn't happen, do you still see yourself going into the sports world? Well, that must have been a sliding door moment for you.
It was. I would always have gone into the sporting world.
Are you a gym goer? Are you a gym person?
Gym,
like myself.
Sport,
exactly like myself. I go to the gym.
What machines then?
I do the old running.
He's lying. The only machine I've seen him use was the vending machine.
No, I'm a bit of a gym goer. So that's been a part of your world then, where you've always been physical, active kind of thing.
Yeah, I don't think, for me, I would never have been able to go into an office job. My mind is too scatty. I have to be active all of the time, and this job for me is perfect because I have to think constantly. Every injury that comes in, you've got to think clearly. I'm working, I'm on my feet all day. Perfect.
Yeah.
It's also something that really interests you. because it's not good having a job and you're like, oh, when can I leave? But it's excited to go and do your job. So
100%.
that's really
But
important.
it's that
as
old
well.
saying, isn't it? If you find a job you love, you never work again.
No.
If you enjoy what, not a lot of people can go to work and enjoy what they do.
No.
So if you're getting that out of it as well,
Yeah.
and again, you get to meet a lot of people. There's a lot of stories as well.
Yeah.
But you've worked hard to get to where you are now.
Yeah.
So if we take it back, then you've done your uni degree in Southampton.
No, so I did my Chichester. That's it. Yeah.
And then you, like you say, you were lucky to get into Southampton.
Yeah.
What was that like going into Southampton? You worked under, was it Steve Sparks?
Steve Sparks. Yeah. So scary at first.
Okay. Yeah. So am I right in thinking my research has given me the information? Steve Sparks went on to be physio at Man City.
He did,
right, for their first team physio.
Yeah.
So, but before then, you were learning off someone who had a bit of knowledge about them.
Yeah.
That must have been a good mentor.
So
but scary.
Best mentor, and to this day, and I still stick to this, I've never met a physio as good as him.
Really?
Ever. No.
Clip that.
Put on
that on
there.
there.
Yeah.
We'll get Steve on next.
It's so good. So at the time, I don't think you appreciate how good someone is because that's your first experience, right? So that was my first experience of being out there in the industry. And then as I've gone through my career, nothing's gone near. It's one of those.
Yeah, like a Michael Owen.
Yeah.
Yeah.
But even having that or witnessing that at such a young age is like the best you could have seen.
Yeah, 100%. Because even when it comes down to like rehab, so it's not just go and do this exercise. You do this exercise, every little thing gets tweaked to what you need from that exercise, and that's the same with every step of that rehab process. And that's something you don't get everywhere.
Rehab's long as well.
Yeah.
So having like
you should know.
Yeah. I know, but just having those little things that you tweak, and it's like, what's the word?
So you're talking English. It's just get a new host, please. Don't try to have a conversation.
No, but like it's for each different individual person. It's not every exercise is going to be different for each person. So one person could do one exercise and it might not work for the other person. But knowing that is really important as well.
And I'd say it puts a different dynamic on it with regards to the football side and the private practice, because football, you're with the same people day in, day out.
Yeah.
That actually makes life easier. It's easier to do all these little tweaks and bits and pieces. But when you're in the private setting, let's say you see someone maybe once a week, once every 2, once every 3, once every 4, it's harder to be specific, but you have to be as specific as possible to get them to where they want to be.
Yeah.
So going back to the footballers then, I'm assuming, so just if people don't know, were you working with the footballers on a day-to-day basis?
Yeah, so every day.
Every day.
What's a day in their life?
Yeah, what's a day in their life? What footballers were you working with?
So the biggest name.
Go on, chuck them out. I had a couple in my head that I said to you earlier. I'm seeing if they come out, maybe. So going back to 2010.
Yeah, so
was
Luke
Virgil
Shaw.
Virgil
was there. He was first team. So Virgil
Trent?
was in the first team. No. Lallana was there. Yeah, he was there still. So we had boys with us. Harrison Reed.
Yeah.
He was there. Callum Chambers was there.
Okay.
We had.
Southampton's always had a good youth setup, unreal.
Yeah.
So Theo come from Trent and all that coming out there.
Yeah, I'd say probably they're up there with the best youth setup in the country. I would say, regards to what they produce and what they bring through. But the whole club was organised well. Everything was spot on, in my opinion. And like I said earlier, I think we were lucky in the fact that we had all these amazing people all in the same place at the same time.
What demands is that on you, being 19 and working with players that you probably watch on television week in, week out, that are older than you, and that is their life, that is their career, that is what pays the bills. The pressure on you to get that right all the time, did you find that as a pressure?
I wouldn't say I'm too bad with pressure. You do get pressure for return. So, for example, if they need a player back at this date, I think that's not possible. That's then pressure, right?
Is that the manager pushing that?
Sometimes being the manager, sometimes it can come from above, right?
Okay.
So it's further than that. So there can be some added pressures there, but at the end of the day, you do your job. You get things as you do to think that whatever you're doing as best you can, then.
And you can't speed around recovery
process.
process.
As a manager.
And I think that's
but
I think that's got better.
Yeah.
As time's gone on.
Player welfare.
Yeah, I think it's got better.
So who would have been manager then? We're talking Harry Redknapp days?
No, it was I can't remember who was there when I was first there. halfway through the season, Pochettino come in.
Oh God,
So I remember him.
Yeah,
he replaced, but I can't remember who.
That was one of his first gigs in England, obviously. Coming in.
Yeah, because that was Southampton were flying.
Yeah. They've always been an up and down club.
Yeah. But I was predominantly based with the 21, so I was with the 21s then, and with the 18s. They were the two teams, but then you sort of oversee everything. So you get all of the youth boys coming in all of the time. And then some of the youth boys would be in with the first team. They'd come back. So it was a good little set because everyone was together. It's a little bit different now because the way the training ground's laid out, first team are now separate. Where they built their new bit. I say separate. They train in there a little bit. They still mingle in, but it's a bit more separated than it was. And if I'm honest, I think I prefer the old setup because the boys feel more part of it.
Yeah, in a split.
Yeah, I think so. I think so personally. That's my personal opinion. I think it's nice for the younger lads to see the first teamers all the time. It's good for them.
So was that I'm sure it's not a 7-day-a-week job. Was it not regular hours? Was it match days? You always working match days? How did it work?
So it was regular hours. So we'd always be in quite early. So sometimes it can be 6:30 in the morning. You'd get in there, but it was always early. The boys would sort of come in between sort of 8:30 and 9. You then get a 30-minute window where we need to assess and decide who trains, who doesn't train, if there's some niggles and bits and bobs going on. If they go out and train, those boys train. Injured boys stay with us. We treat them, lunch, and then after lunch you go back into either another phase of training or whatever that would be that day. And injured boys, we could have some in the morning and then find to go out and train in the afternoon, and some would just stay with us all day, and then we'd wrap up sort of 6 o'clock.
Still 12 hours.
Yeah. And then obviously you do your match days as well. So 6 days a week you're working pretty much. So
were you travelling away to your away games as well?
Yeah, you'd go travel away games.
And where you are down the bottom, there's nothing local. No. Unless it's Portsmouth in the same league at the time.
Yeah. And you all travel together. So I would drive up to Southampton, even for an away game that would go past my house. So I'd drive up there, get the coach, and then you'd see on the M3 next to Fleet, you go past Fleet, and then back to Southampton and drive home from there. So.
It sounds like every physios and sports therapist
so interesting
to work with something like that. Right. But I can imagine you see it as the first time you start doing it, it's good and it's enjoying it, but then it's your job. You then come into your own and go, this is what I have to do week in, week out, and you take that as what it is. But like I say, the pressure then, like you say, the managers have changed with not having to rush players back. Did you notice there was a little bit of that then? If there's a big game coming up, can we not have him for a week?
You get it, you do get it. And sometimes, player welfare for us is always our highest. But there is sometimes negotiation with regards to, he is pretty much ready. It's a big final. If it was a big final, for example, if it was a normal, so there is that aspect of, yes, we have to keep them. We're always on the side of caution, always. But some say, okay, if you want him to play, he can play. That's on you.
Did you work with the sports? I don't know if it was at the time then. Like sports analysis is massive now. The red zones, the green zones. Was that creeping into yourselves then?
It was
as
there.
It was there. Because I hear people say. Sometimes I hear from on the Talk Sport. This is where I'm getting my knowledge from. These are not stats. They're saying sometimes let them play in the red zone so they can see they can push themselves further than what they think. As a sports therapist, are you saying no?
Yeah. So with regards to red zones and bits and bobs, with regards to fitness, it's a difficult one because some players will hit their red zone within 5 minutes, but they can maintain that red zone.
Yes. Some
will hit red zone right at the end of their fatigue level, and they're done. Right. So it's a difficult one with like the zones and bits and bobs. But we had the sports scientists, so we'd work closely with them. So we'd do our bit, sports scientists do their bit. When it's a rehab return, we basically integrate with each other's bits and pieces because we pass from one to another to get them back to their peak performance.
Well, you've got to be on the same page, so that's what's got to be done.
So you have to be able to have a good connection with your sports scientist, because if you don't, it's an issue, right? If you clash or whatever it would be. So
So I manage a women's team. I'm not putting this in the same category as Southampton, but I also know I've got players that are injured. I'm fine. Did you ever come across players who would give it the old, I'm okay, but you know they're not fit to play.
The stubbornness.
Yeah,
yes. Every player wants to play.
Yeah, so they will try and mask injuries. Sometimes they can successfully.
Really?
But you can, obviously, if they're limping, you can see it, right?
Like you. You're limping, I'm fine.
But sometimes we do certain assessments, right? And we can see if we can find bits and bobs. If it's just pain and they can hide it for a certain period until it gets too bad. But if we can find it, we'll say, look, and you can see it, like sometimes they'll wince or they'll do something that you can't get through it. Or if they're okay, let's do a higher level test, see if you can get through it. Can't get through it.
Yeah, okay, so you're testing them to see, let's see who's right.
Yeah.
Okay.
But sometimes it can be, they'll say they're fine if let's say they don't lose their place, which is a thing, right? And then some managers will say, if you're injured, then you're not playing it, or don't play then. So it can be, it can get tough for the player as well as the manager and the physio. So I think there's pressures from everywhere. And
you're just trying to do your job. I've got everyone coming me here. I'm just trying to do this.
Yeah.
So we touched earlier on Steve Sparks, your physio. What you say he was the best person you've ever worked alongside or worked with as a mentor. What made him so good? What did he give you that just developed you in that for those years you were at Southampton?
So, to be fair, he had pretty much everything in regards to time, put time into me as a person. So he wasn't just go and do this, go and do that. He would talk through every single little thing that he did and he'd make sure you got it. And every day he'd put that time in. He sits there, he listens to your questions, he goes through it. If you're not sure of something, he goes through it all with you. He just loves the job, right? So he's like he's up there with every day. He's loving what he's doing, and it reflects in what he teaches in regards to that side of things. And I think it's some people are good teachers, some are not. So he's a good therapist and a good teacher. Everything makes sense when he's teaching it, which sometimes doesn't come across with everyone. They have the knowledge, but when they're teaching it, you're not picking that up because of how they're talking through it, if that makes sense.
Yeah, of course,
breaks everything down into detail. So I think that's what, for the boys as well, that's what makes you like an elite.
Yeah. It makes it easier to learn as well, more enjoyable, where it's like, I don't understand it. And then you just go, okay. But then you go, oh, he actually wants me to ask questions. He wants me to understand.
That's key. People are frightened to ask questions.
Yeah, exactly.
And that's one thing. It's never frightened to go and say, help me with this.
Yeah.
That's a big part of it. That is a big part of it. If you didn't want to ask, or you're too scared to ask because you get backlash, then that's a big part of especially when you're learning, when you're that young as well.
I think, when I was young once, you're still young now. When you're trying to learn things in life, if I ask, they're going to think this. But there was one time where Steve didn't know what he didn't know.
Yeah.
So for them to take that knowledge on, reciprocate that into yourself, and go, well, this is why we do this. This is how we do this. Then build you as a person you are now.
Yeah.
And obviously he had a lot about him. Then to go from Southampton to first team physio at Man City as well.
Yeah.
They're talking 2020 when they were still flying now, but that was when they were peak. As well.
Yeah. Yeah, so he's seen it all down to the treble, obviously.
First ever Man City treble,
so he saw it all. But when I came out of football, that's when I realised he'll make it to the top.
Really?
Because at the time you don't. But like I said, you don't. Say you don't.
You absorb it and what it is.
You just don't know. But then when you come out, you think, Christ, he's good.
So on that, then let's move into that. You took us to it. Why did you come out? What was it? What was the changes? What was the difference?
I've always wanted. So two things. I've always wanted to run my own thing, be my own boss. Yeah, that's always been an aspiration of mine. And the second is I've always wanted to bring that level to grassroots and surrounding areas, because it's not that easily accessible. It's not that easy. It's tough, right? So, and that was the driving force. And that's where we've obviously gone over the years, ready to produce what we're going to produce now. And everything I've done over the last sort of 7 years since I've gone full time is driving towards that goal.
But that shows your character. You could have easily stayed there, but you want to take all that knowledge and give it to others.
Yeah.
Whereas you could have just stayed there, like you said, Premier League. Why did you want to give it to other people? Why did you want to pass that on?
I think for me, so I suffered actually quite badly with injuries as well as a youngster. The old knee injury.
Yeah, the old knees again. Yeah. My left and right.
And I think having gone from that to then going into that level, and think, no one gets that.
No.
Like, no one ever gets that level of support, that level of care. So, and having been through, and even now, I work with football clubs now. You don't get, no one knows where to go to get that level of training or physio, or whatever it would be. So if I can bring that to the surrounding areas, then it's giving back something.
And people that actually know what they're talking about.
Yeah.
Because you go, oh, there's a physio down the road. You can go down there and then be like, are you actually going to help and tell me what's wrong? Or just take my money and then not actually do anything?
It's one thing with regards to when I started. So I obviously assessed the clinics in the area. And at the time, it's a completely saturated area with physiotherapy.
In where we are now?
Yeah. Okay. So where we are, Farnborough, Fleet, Camberley, Aldershot, they're saturated with physio clinics and other bits and bobs. So I had a look at what they were doing, and I believed in what I was doing. Was
back to yourself.
Yeah,
that's what you've got to do, though. Yeah.
And
do you know what I am? I've got 10 years that's about to be on me.
And I offered what I could offer was more. So I put a lot of time into every single patient. So, for example, you would have gone through your physio bits and bobs. A lot of time you go to a clinic, do the treatment, happy days, do it fine, then give you the most basic rehab plan to follow, which for me is not good enough. So everyone gets that treatment side of things, rehab in clinic, and then a very, very detailed rehab plan, which I spend hours on at the end of my day writing up for everyone. So my days are actually longer than they used to be. So I do my 9 till 8, 9 a.m. to 8 p.m. every day. I get home, I walk my dog, have my dinner, and then I write rehab plans until 12, 1 in the morning every single day.
And that's the bits that people probably don't see.
They don't see.
I mean, they see the assessments in there, clocks off at 5, goes home, but it's not like that.
No.
But that's where you, as part of your character, you said you want to give back.
Yeah.
Is that what sells you as a person, as George Gore Clinic, above anyone else? If you want to be the best, you've got to put extra in like you are now.
That's what's made us so successful. Yeah, it's 100% that, because it's the main comment we get is the level of care. So even if someone messages me at 11 p.m. at night, I'm messaging back. I make sure every job is done on that day, every single day.
That's what makes you different from everyone else around this area, though.
Yeah.
Because you're just tweaking everyone else's thing and going, yeah, we're here, come to us.
Yeah.
And you probably, everything you say is probably very, very truthful, and when people come,
people buy into that.
Yeah, people buy into it.
You're giving them your body, right? You're giving them, you're asking, look, I'm in trouble here. What can you do? How can you fix me? To put that trust in a stranger is you know that from you've had to do it before.
Yeah.
To put your body in someone's hand and go, look, I trust you to be able to help me get to where I need to be.
Yeah.
Is a big confidence thing alone. And obviously, if people are coming for injuries or problems, their mental health is low, especially as footballers as well. Yeah. We've had a few footballers on here in the past who have had injuries, and the rehab bit it's been helping. It's when they go away from that and they're at home, they're thinking about it. That's been the hardest bit for people as well.
Yeah. So actually, even recently, I reached out to a lad that had quite a horrific knee injury. Had a little look, saw it on TikTok, and I said, look, come in for free. I'll do your whole rehab plan for free.
I would have loved that when I had mine.
It was just something, because it's an injury that you don't see that often, and it was so horrific. I could see the mental impact it had, and obviously, I believe I can help him. So brought him in, and the
man needs a knighthood at the moment.
Yeah, honestly,
you know what I mean? He's just giving back to the people.
Yeah, but I think you have to a certain extent. I think if you're going into any medical world, I said the same thing to if like one of the youngsters comes to me and says, like, I want to get into this. I listen to what they ask me, what they want to achieve, because a lot of people say, I want to run my own business. If the first thing they mention is money, I don't entertain it. But if they mention what they want to do, so with regards to helping people, because obviously you can't live life without making money. You have to make money, right? But you can do that in the right way, giving back and doing the best you can for that person. Because for you, when you're injured, that becomes your whole life, doesn't it? At that point, so everything for you every single day. If I can give you back your football career, happy days.
Yeah, and also because it's so tedious. If you're going into a place where it's just the same repetitive stuff, it's like you're not motivated to do it.
Yeah.
But then if you're going into a clinic like where you work, it's like, oh, I'm actually excited to go and do my rehab, and then you do it to its full extent, and then you're like, okay, I actually see results now, instead of you just do the exercises and you're like, oh, that'll be fine.
You're the end goal, aren't you?
Yeah. But in the process of doing it, you've got to do it to 100%, 120%. Otherwise, you're not going to see the results. So for what you're doing for the people, it's really good for the people.
So what were your biggest challenges did you face? Obviously, you backed yourself quite heavily just to come out of Southampton. When you were going to go it alone, what were you thinking? Were you thinking, is this going to work? I've obviously backed myself. What were your barriers were you facing?
I thought it would be easier than it was to build, if I'm honest. That was the hardest part, was the building of client base.
Was this before COVID, wasn't it?
Yeah. So before COVID, because in reality, no one knows you. That's how it starts. Right? So you come in, like, who's this guy? He's come around. So I actually did it through offering a free service. So I sponsored a few athletes, and this was in different fields. This wasn't just football; it's in other fields. And ended up working in mixed martial arts for a while, for a long time.
You worked with Alex Reed?
Yeah,
I said a little bit of that. Yeah.
So I worked with him as well. So that was the field it sort of took me down initially.
How was that, working with mixed martial arts? Because there's some different injuries there compared to your football. You know what I mean?
Yeah, different injuries. It all sort of comes together, because at the end of the day, we're looking at the body, we're working on what the injury is.
It's not how it happened, it's what the injury is.
It's just as you get more towards the later stage of rehab, then things will change slightly to what it would be for a footballer or that side of things. But I really enjoyed it. I think working in different industries well helps. I worked with bodybuilders, worked with marathon runners, worked all over the place. But for me, my obsession has always been football, and it always will be.
What's it? Your sport team?
Arsenal fan.
Oh, we're finishing now. We've got the pod now. Okay, Okay, so don't know what to say. So your football's been the main thing. So in the second half, we're going to come on to your women's football and how you want to start dealing with that. And we've got quite a few questions on women's football. When we mentioned you were coming on, we were inundated with questions from women about certain injuries in ACLs, which will come on to the second half. At the moment, what injuries have you seen that have been more prevalent? Is there a certain injury that you keep getting coming up in regards to men's side of football, or?
I think they always stay sort of the same type of injuries. So you get a lot of ankles, knees, all lower limb. Let's say lower limb is your main focus, rather than, unless it's the goalkeepers, then maybe they have a few other bits and pieces. But lower limb injuries and knee injuries. Obviously, knee injuries become quite significant, because especially if it's an ACL, for example, it's a long term, isn't it?
That's all we talk about at the moment, ACLs.
Yeah, and when we come on to the women's side of things, ACL is
we got cards for that. The other thing we did have a question come in about injury and recovery is how important is nutrition and diet? Is that something you've had to focus on at all?
So yes and no. So we do cover bits of nutrition. It's a bit like saying earlier, we've got bits of nutrition, bits of S&C, bits of psychology, but then you'd have specific people for those roles, right?
Yeah, so you can send them out that way for.
Yeah, but regards to the nutrition side, you're looking at 80% of your lifestyle should be, so your nutrition should be 80% of like your recovery and bits and bobs.
And why did I know you were going to look at me then, right? Danny's looking. I've started my diet. Was it 2 months ago?
Has it started?
It started, and my nutrition is just not where I want it to be at the moment. And everyone keeps saying, "How's the diet going?" And it's we're getting there slowly, very, very slowly.
But it's difficult. I think nutrition is difficult because it's a consistency thing, right? So it is difficult to. It's getting everything organised, and especially let's say you get injured. Suddenly, sometimes you think, "Oh, I'm not going to do anything." Like, I hate everything, hate life, and then all that consistency, because life has changed, goes out the window.
Routine. My problem has been we've just got over Christmas, and our Easter eggs on the shelf. So that's where I'm struggling diet wise. It's not through routine. It's just laziness and choice of habit. So that is the first half of the pod. We're going to bring Sian on, who is George's other half, also his business partner as well. She's going to talk us about the new football rehab centre coming on, and we will be getting into what many of you asked is the female ACL injuries. Why is it happening? How prevalent is it going to be? What can we do to stop that? And also we want to touch on the menstrual cycle in women's football as well, with injury recoveries on that. So please join us in the second half for that. Right, welcome back, guys, to part 2. We are now joined, visual viewers. You'll see Sean is here with us. Sean is George's other half and also part of the business, which we'll be talking about. But what we have had a lot of, and I can't believe the amount of people have asked this question, and to be fair, we wanted to know ourselves how much ACL now is in women's sport, especially women's football. Week in, week out, we're hearing all about ACLs. So, Danny, take it over.
So, let's start off. What is an ACL?
So ACL, anterior cruciate ligament, and it's one of the main ligaments inside of the knee, which essentially to hold the knee joint in place, right? So from the femur to the tibia, so the two bones, keeping that connected. Yeah. Essentially.
Yeah, it's honestly not amazing, but it's crazy how many ACL injuries are actually happening at the minute, and it's like one after the other after the other. I go, there's another one that's been happening, and I'm like, how can we prevent that?
Well, why now? Yeah,
why? Why? How?
So obviously, it's classed as a little bit of an epidemic at the minute, right?
Yeah.
So it's quite serious at the moment. So there's a few. I could go on all day about ACL.
That's fine. That's fine.
So there's a few issues. One, research is poor for women's sport and women's football in general, because predominantly all of the research is done on males. All the training regimes are designed around males. So that's two big parts. We'll talk about the hormones obviously shortly.
Yeah.
We've got the biomechanical factors of women's hips generally wider. So you've got this Q angle that comes down, creating more force already. The ACL is smaller, which can be another issue. Football boots.
I said that.
All designed for men. So stud placement, all designed for men. All of these factors are being looked at, but obviously research takes time,
it's a slow process.
And there's some major factors. I don't know if you'll be going into certain
everything. Yeah.
Okay, fine. So we'll go for it one by one.
Okay.
The more you talk, the less we've got to do.
Fine.
This is so interesting. I'm so interested.
We get people ask us all the time about things. So to have someone on here who is literally, this is their bread and butter, I can then go, I'll tell you why, and I can look better in myself.
Yeah.
So I'll be learning a lot from you right now.
Fine. So feel free to jump in with some questions and bits and bobs, because I'll just ramble up. Basically, if we look at, say, one factor, so if we compare males and females, females tend to be more quad dominant than males. So hamstring and glute recruitment is less so than what it is for males. Now, if we're looking at an ACL point of view, the hamstrings are meant to hold ACL, well, the tibia in place, right? As we go down. So as women are a quad dominant loader, and they tend to load quite stiff legged, as opposed to a man would load with more of a knee flexion, so more of a bend. The stiff legged position is also one of our prime issues with an ACL. And then you have this lack of hamstring early engagement to hold in place. So then as we go into the internal rotation, the adduction, so where the knee comes in and collapses, then you've got the smaller ACL. So all of these factors, just from that biomechanical point of view, just there, can lead to a rupture.
I did not know women have smaller ACLs.
Yeah, so cross-sectionally, they're a lot smaller than males.
That's crazy.
And the groove is smaller as well. So there is issues with that side. So that's just one point of view. Then we've got the football boots we talked about, but someone needs to go and design a football boot, right? So that's which I think Nike are working on it at the minute. I think,
but they're also so expensive.
They
want you want to wear women-made football boots, but then they're going to cost £300, and it's like not everyone's going to be able to afford that.
Yeah, until everyone catches up with their all design, it will be expensive at the start.
First on the market.
Yeah.
We've put the research in. We found this. That's what it's going to cost.
Yeah. And then if we go on to, say, training regimes, right, in the gym, most of the time you'll go and train in the gym, you'll do your own thing. Or someone will send you into the gym, do the same plan that a male footballer would do.
Okay.
Now, for females, we have to focus on more posterior chain. So they're talking about the glute and the hamstring, because it's the weaker area to support that ACL. Whereas with a guy, with a male, you would do more short, high intensity burst of training. With a female, we have to flip that, do more posterior chain. With talking through, this is more in the S&C type thing, so the strength and conditioning, but women can maintain their peak force for longer with less fatigue than a male can, but their force development is lower. So the rate in which they can produce force is lower, and their stretch shortening cycle, so the explosiveness is also reduced. So if you're going to send a female to do a male-based football plan, you're not getting what you need to get out of that. So we would need to put females through more of a force development and stretch shortening cycle plan, more so than a male would have. And you can do longer bouts of certain things. But then we come on to the issue of the menstrual cycle, which makes it difficult, because you have, obviously, we go through the 4 phases. So you've got your 4 phases, and everything is different per phase. But we've also realized as more research is coming out, it's more individualized than we first thought it was.
Really?
Yeah.
So I was told, these are the stats I heard, so in my head it's true, you can correct me. Women are 3 times more likely to get an ACL on their period than any other week of the month.
So, so they are.
Clip that, I'm right. Clip that, ship that out.
They are, and the research to a certain extent backs it up.
Yes.
But there's so many more
anomalies
coming out. Whereas, say, for example, someone might be in a phase that we think is their peak performance phase, but they feel knackered and they feel like they're fatigued and they get ACLs in that phase, right? It's much more individualized than we first thought, but we can, over time, it will group more. There'll be more groupings going together, but it's not as easy as this phase is the one we protect everyone in. But then it comes to
branches coming off then.
So you do get more in certain phases. So if we're talking about the ovulatory phase, you get more ACLs. Your performance is actually at its peak in that phase.
Really?
But ligament laxity is at highest. So
you're pushing yourself more with less.
With more elastic ligaments at that phase. So the potential, and we're talking about the landing mechanic we were talking about earlier, your potential for ACLs is higher. So it tends to be higher in that phase.
Easy.
I just don't do any running or moving or anything. That's the way I go with that. So the other stat I was told, again, don't know if it's true, is you're more likely to get an ACL on 4G pitches. Is that true? Is it false?
So again,
I'm on fire today.
We need for everything, we need more research coming in. But regards to 4G pitches, they tend to be heavier loading, because if you think about 4G pitches, essentially it's fake grass on top of concrete. Right?
So there's no spongy for the mud. Okay.
So especially when you get into the fatigue levels, we're getting tired. There's no give.
So makes your muscles so tight as well.
Yeah.
And it's that hard impact all the time. So
you mentioned something a minute ago, and it takes time to trickle through my head. Stud location on boots.
Yeah.
What? How can that affect an ACL?
So foot mechanics are completely different. So women tend to have.
It's just like I feel like I'm back at school, right? And I'm learning so much more than I ever learned in biology. I tell you.
So tend to have slightly wider feet on average, but the foot will collapse more so.
Okay.
So it all links as well back into the force development side. So if something collapses, there's less of a spring to go back the other way, right? So we collapse in, we then have to use that to then spring back the other way. So stud placement for females is going to be important to determine where that foot will collapse, to put the studs in the right places for that, to allow for that collapse and compression.
Do you get that?
Yeah.
I'm going to listen to this 3 or 4 times. So with the ACL and the menstrual cycle, can anything be done to prevent an ACL in that time? Is it to explain to us how we can not stop it happening, but make it less chance?
Yeah. So from the physio point of view, we work a lot more now on posterior chain. So we do a lot more hamstring dominant exercises, glute dominant exercises, try and work on knee flexion. So from landing, knee flexion from landing, neuromuscular control. So your balance and your control through movement. There are big ones. And then from the S&C side, working on that posterior chain, but also working on deceleration of the hamstring. So by that, I mean, if you were to sprint and slow down, that hamstring needs to be able to react quicker. So for females, it's delayed, like I said earlier, and the quads become dominant. So we need to train that system to be able to become more dominant, so so that we can stop the potential, right?
Yeah.
And then when it comes into menstrual cycles, we then have to be a bit more picky on when we do certain things. So if someone's in a phase of the menstrual cycle where they're more fatigued, we can't just keep pushing them through into more fatigue, because then we cause a bigger problem, right? So one other aspect we've got is when females tend to fatigue, their core and their trunk stability is lower. Couple that with the Q angle and the stiff leg land, again, chances higher, right?
Yeah, we're stuffed.
Yeah.
So
we have to lower intensity in certain points and push harder in certain points. So this is what I'm saying with regards to males. If we look at a male, we can push, and we know when to push, we know when to deload, right? With the female, there's certain times of the month we have to push, then we have to deload, we push again. So we have to be much more specific, and that's where I think everything's going wrong, in the sense of it's all just go and do this, and we're trained like this. But how do you make it more specific when they're a team, right? So
yeah, and this is the thing where we sell for me. Obviously, I mentioned it earlier. I've got 20 players. I put them all for the same training session. I've got it right. Same training session on a Tuesday. A couple of them might be going for their menstrual cycle, but again, they're going for that sort of same load rate. So for grassroots people like myself and other managers at other teams, that's a lot of information to try and take in to specifically coach certain players in certain groups 1 hour a week and stop them from getting injury as well. So that's phenomenal, a lot to take in, really.
Also with like the knowing which part of your cycle you're on, with a client, do you always want them to be like tracking, like on an app or?
So yeah, apps are the best way to
they
check,
do
right?
that.
Yeah.
Well, I didn't know that.
Yeah, so apps are your best way to check. And so I am actually I've been working on it for the last 2 years, but we're not fully finished yet. So we are actually I'm working with a football physio, a guy called Chris Onofrio. We are developing something for women's football for that specific reason.
So, is that exclusive? Is that exclusive?
Yeah, exactly. Going.
Yeah. We've got to cut that bit out.
Yeah, we've been working hard at it for a long time now, putting all the pieces together, and we are going to, so for the grassroots, and we're going to come up with, but we need the research coming in, because it's without research
for the app to work, or before the app.
It will work, but for things to develop, as with everything in life, you need more research coming in to develop something to make it better, if that makes sense.
Yeah, of course, yeah.
Because you have to go off what you've got, right? So you go off what you've got at this time, and then you make things better as you go along.
Yeah, like the data that the app can collect will then obviously help with that research. It's sort of an inside way of gaining that research while still doing the job it needs to do, if that makes sense. So
we're going to bring Sean in now. Sean is going to tell us all about the George Gore, I'll just keep that right out. The George Gore sports physiotherapist, but predominantly dealing in women's rehab centre for football. So please tell us all you can about that.
So we have got, like you say, a really exciting sort of extension coming up. We extended the company last year anyway. We've got 3 further therapists. George, we've got Aaron, Maddie and Michael, which we're really lucky to have. A lot of people would have sort of seen them. So that was sort of phase 1 of the expansion. We've built them up over time. And so this is now phase 2. I think especially for George, the dream has always been to have his own place, because it's all very well sort of being based within another gym environment, but there are restrictions that come with that. It's not the type of work George and the other therapists do. It isn't your standard sort of PTing in a gym type setup. A lot of the equipment is like you wouldn't even necessarily use, would you really?
Oh, so Shannon Mather sent in a question. I know you work with Shannon.
Yes.
Shannon said, what equipment would we find in this specific rehab centre?
So it is rehab specific equipment, more focused at lower limb.
Yeah.
Because we will have like the normal free weights and stuff like that, so you can do upper body. We've got the testing equipment as well. We've got force platforms that will sort of track your baseline and do your sort of performance analysis tests on that. Other equipment, you're probably better off. Sort of
so we've got
all the names. I'm like,
yeah. Okay, yeah.
It does this.
George is on the mic now.
What it's called.
because you wouldn't find force plates in the gym, right?
What's it called?
So I actually used one of them.
Yeah, okay.
When I was with the NHS doing my physio.
What are they called? Sorry.
Force plates.
Again, explain.
What? I got to explain.
Yeah. Force plate. Yeah.
So
I just know a dinner plate. I'm out.
So with the force plate, so you got square platforms you stand on, right?
Yeah.
So two both sides, one for each foot if you want to use obviously balance or single leg, whatever you want to do. Now we can analyze pretty much everything on a force plate. So we could get you to jump and land as an example, right? The force plate will tell you how high you jump, how much you're decelerating through one limb compared to the other, what you're loading through, how quickly you're producing force up. So when we're talking about the force development side of things, we can test all of that. So it's a good way to monitor performance. So especially if, let's say you're struggling with one knee, but you look like you're okay, ready to return to football, by getting on force platforms, and suddenly your power development is not good compared to this other leg. We're not ready yet.
Nothing can be hidden on a force
No,
plate.
can't be.
Really?
Yeah,
So
I was doing it, and obviously I had surgery on my left. It was like I'm not putting as much pressure on my left because I was that mental side again. So it was like you're doing more when you're right, but you need to balance it out. And it was like that process of being like, right, I've got to use both legs to jump up and land.
Yeah.
So you get in competition with yourself as well. Because like, I did that last time. Let's see if I can get the numbers up a little bit more.
Exactly that. I was like, I've got to make this a competition.
And it could be the stage like, let's say you look good, everything looks good, your squats look good, your jumps look good. But let's put some weight on, put a barbell on, do the same thing, do a squat there. Suddenly then you're loading the good leg. And tons more again. So there's
a lot to this, isn't there?
Yeah, test everything.
This is why you do your degrees. You know what I mean? This isn't just a piece of paper. This is a lot of information.
Yeah.
You're taking on board.
But we would then couple that with this dyno I was talking about. So that we can test individual muscle groups. So it's a machine and it tests it to the point. So it could say you're pushing through 46 kilos real quad, for example.
Yeah.
And then we compare it to the other side, that might be 46.2. Okay, happy days, that's even-ish. But one muscle group might be significantly weaker, so we know
to work on that muscle group.
Yes, then we'll work on that muscle group. So and balance everything back out again, because force plates will give you a general, and let's say you think, okay, there's weakness there. Okay, then we found that the left quad is weak. Train that left quad. Yeah.
It's like a car. Plug a diagnostic system into a car, and it gives you all your problems. And I've got a lot of bad cars. Yeah, full body MOT. You know what I mean? Yeah.
So I think
it's phenomenal, isn't it?
For us, they're vital.
Vital.
So that type of equipment will be in there, but then we'll have equipment for speed, so attaching cables, sprinting. Your power comes up on.
You're excited.
Yeah, we literally have everything in regards to that, and then we've got the recovery side. So you've got your recovery pods, you've got your red light therapy, your ice baths, your saunas, etc. So
it's like a spa as well, the ice baths.
Yeah.
So how did this come about, Sean? How have you got involved in the business, obviously? And you developing in or working with females in football? Why specifically females in football?
I think so. Sort of going back to how I got involved, I had my sort of full-time job. We had a baby last February. She was born quite prematurely. She was born at 28 weeks. So she spent a decent amount of time in hospital. And during that time, you are sort of at a loss because you're not coming home with your baby, and it was quite a lot to go through at the time, wasn't it? And it was more, right, this is our drive. Like, she's been in this position and she's fighting like hell to be here. The best we can do is sort of give her like a legacy to come into, if you like. And that time has allowed us as well, obviously being on maternity leave, to get involved. Originally, it was meant to just be admin.
It always starts with admin.
That's your selling point. Start there and just do that for me.
Honestly, it started off with a couple of invoices, or could you just email these couple of people, or just check my email for me, do a couple of posts on social media.
You've done well there.
It then turned into floor laying, room decorating.
It's a woman's touch. You've given it a good woman's touch, right?
Interior designer.
I am. Honestly, if I sat here and named everything that I sort of get involved with, but it was the perfect time. Like, we had the time off. Like, it meant that I could then spend more time at home with Fionn, our little girl.
Fionn all okay now?
Yeah, she's
brilliant,
perfect.
lovely.
She's perfect, loud.
Yeah. Yeah. Kids have no volume buttons.
No. No, she's perfect, and like I said, it meant that I can spend more time at home with her. After all she went through, like I said, she fought for her life to be in. The least I can do is make sure I'm there for her as long as possible. So it fit well around that. Then obviously we had the extension. So when we employed the other members of staff, it became my role to sort of, I don't want to say manage them, but more manage their diaries, advertise on their behalf, get content for them, deal with any sort of issues they may have, and sort of just be their go-to person. Because a lot of the time George is back-to-back in clinic all day, every day. We were getting inquiries during this time, emails, phone calls, all through to like George's private, like personal number. So it was easier for us to just have that business number, so I can then get back to inquiries in a timely manner. Because by the time George finishes work, it's like 11:30 p.m. at night. We're like, "Hello, how can we help?" And they they're normal people.
Yeah.
Just getting like the social media side of things. We're both not great at social media. I'm a bit better than George.
I hate it.
I'm not. Danny does a lot of our social media. I put a post up yesterday for Emma Match's birthday. And I was like, have I done this right? Just putting a post up on Instagram as a story.
He checks with me now.
I
He's
don't
like, I'm
know
going
what
to
I'm
post
doing.
this.
Yeah,
and I'm like,
that's what I did. Yeah.
Mess up my what's his face aesthetic.
Yeah.
So yeah, it's just having the time again to be able to do that, because like George is only one person. He can't be sports therapist.
And George does a lot. I'm batting for Georgie. He does a lot, doesn't he?
He does. But he can't be all of those
of course.
people. So he needed my help, and we're just fortunate enough we've got the business into a position where I have managed to been able to quit my normal job. So this is my full-time job now.
And how's that working together?
Do you know what?
I
think it's
this is a safe space. This is a safe space, okay?
Knows how I went.
Yeah. The hands went up.
Like, it depends on it.
He's going to start going, I love working.
No, I think we work very well together, because we've both got different aspects of things we're good at within that business. Because for me,
not in agreement.
Well, yeah, because there's no conflict. Because I'm not a sports therapist.
Yeah.
I don't have a clue what he does day to day. Like a lot of what he's just spoke about, like it will be in one ear out the other with me. So there's no conflict in that sense. Like he won't sort of go, oh, I've got an idea for this treatment plan or this treatment plan, and we go, oh, actually no, maybe you should try this. There is none of that. Equally, and I know you might be saying this, but you're not a business brain. Like, he has ideas, but he doesn't know.
But you don't need to be. That's what. It's perfect for you.
Different aspects.
We have that. It's a good balance. Sometimes it does get to the point if it's like midnight, 1 a.m. and George is there still rattling off this new idea that he's having. He's actually excited, and I'm like, I'm so overstimulated. I just don't want to talk about work anymore.
Yeah.
Because it is like we do work quite late. Like you say, if anyone messages us, we will message back. It doesn't matter what time of the day it is. The baby doesn't sleep anyway, so we're up. But yeah, so it does work quite well. We've had a few differences of opinions.
Here we go. There we go. This is what we come to the table for.
It's learning how to sort of manage that, and to have that separation of work is work. Like we are a family at the end of the day. We've got like the 3 kids at home, so it's sort of managing that and not taking too much frustration out on each other or taking things too personally.
Yeah, of course. Yeah. So where are you based? Is it open now? Where are you based? Give us all the selling details. So if people are going to look for you, how can we find you?
So we're
This
still
is the
operating.
big bit. This is the main bit. The plug.
Yeah, we are still operating. We're currently working out of a temporary premises whilst we are securing sort of legal document contracts and
the boring stuff
and the stuff that takes the most amount of time. Solicitors, like, it'd be great if they reply instantly, but a lot of time they haven't been. So they're
not all like you, you know. I sleep.
But yeah, no, we have been met with a few delays, which in our mind, in an ideal world, we have a magic wand, we would be opening in February. But reality is we're still not actually in the building.
Okay, but you'll get into where you want to be as a process.
We've got everything lined up. Like we've got the gym installation people, we've got like equipment investors, we've got sort of plans of how we want the place to look, plans on how we're going to deliver things when it does open. So it is literally a case of get in there, give it a facelift, hit the ground running, and try and turn it around as quick as possible. It just all depends on when these negotiations can be finalised and we can get in. Like I said, we were hoping to be in 3 weeks ago. So
yeah, no,
it does take a while. However, we are still operating. We are still seeing our normal patients. Our normal business model that it has been for the last however many years is still going on, just in a very temporary premises at the minute. But yeah, once we can get in there, it is literally going to be all hands on deck to try and get it turned around. Once it's opened, we've got big sort of plans, haven't we, for how it's going to be run, like offering classes, sort of access to more sports therapy based memberships rather than just your standard gym membership. So all memberships would include a sports therapy session, because if you're in the gym, then you need to be taking the time to look after your body as well. Those sessions can be used for injury, soft tissue release, if it's like posture analysis, just checking little niggles and stuff. It's just so you know that whatever the eventuality, especially if you're training a lot, if you're playing matches a lot, you have like you've got someone in your back pocket to go to and ask these questions to.
That's like you'll be needing that straight away. yeah.
Just on that point, so I was talking about the academy saying earlier.
Yeah.
So we also prepare and have got the coaching stuff ready. The S&C side, Premier League S&C coaches ready to come in. So we've done it all. We've gone through it all.
You've gone big.
Go big or go home.
Yeah.
Because we need to keep that same standard all the way through, and to give back, that's what we're going to have to do. So we've got that knowledge base. So then, because then once everyone starts collecting their little bits of knowledge, then you can go and do it, right? You go and do your own training stuff. So
there's nothing like that in this area.
No.
This, like you guys talking about this, I'm so excited for people to hear about it and more people to know about it.
So just tell us where it's going to be, Sean. Where are we going to find it? If we're in the country, where are we going to find you?
Just over in Farnborough, up to
That's
the
up the road, is that?
Very local, not far from where we've always been based. So it won't be a change for our sort of existing clients. But yeah, not far at all.
Bearing in mind you've got Farnborough, Aldershot, Farnham, Badshot Lee, which you said you work with. Ash, you've got a lot of female teams around here, more starting up as well. You've got this saturated area for women's football, which is only going to grow as well. Which is perfect.
And our hope is that we can host whole teams at once to go through a physio-led training session. So to give them and coaches and managers the tools to be able to deliver like a pre-activation warm-up correctly in the best way to prevent injury, or to educate around the sort of period with the impact on injury, so people have their own individual knowledge. Because like you said, like once they've got that education and that baseline, they can then go on and they're a bit more informed when it comes to training and matching.
This is like a breakthrough for next step sports therapy and science and everything. It's the next level, like you say, there's nothing around here as well to have that.
That's our hope as well. And we know that like with budgets as well, we know especially in women's football, budgets are tight. They don't get necessarily the same allowance or the same funding as the men's team. They won't. Many of them don't even have a physio that they have access to.
I know. I'm the physio. Exactly. I'm the physio.
Exactly. And those that do have access to physios, it's more just pitch side stuff. So on the day, emergencies and stuff. There's no
cold spray.
I've got a sponge and a cold spray, and the spray bottle's been empty sometimes. I've got I filled it up. But I've got to get on there anyway and just do the business now.
Honestly, I'm old school. Blue paper towel fix.
Yes, you saw it. That's what Danny said.
That's why I'm not.
You're cringing there. Not what I signed up for here. So, have you got an Instagram page, a TikTok page? How can we find you on the socials?
So
everyone's on the socials now.
We've got our Instagram page, which is George Gore _sports therapy.
Go and follow that, everybody, please. Thank you.
In the world. And our TikTok, which I am still learning about. We've got a few cringy ones on there, haven't we?
Oh, we'll go on there tonight and have a look at that. That's fine.
Our TikTok is literally at George Gore Sports Therapy. So it's just the Instagram one that's different because it's got the underscore. But yeah, we're probably most active on Instagram.
Okay.
We will, once, like I say, we are in the building, we will be documenting the whole process, sort of behind the scenes, what stages we're at, showing sort of clips of what's been installed and when.
So we can follow your process from now up until day one live.
Yeah. And obviously, when it gets to the point that we are able to open, we will have a big open event. So everyone is free to come down, take a look around, speak to the therapist.
Sausage rolls on the side, glass of champagne.
And like George said, it is about having that whole package. And when he was talking about his time at Southampton and how integrated every sort of like S&C coach, sports scientist, sports therapist, or physio were, we want to sort of replicate that. So that's why we have got the S&C coaches.
Yeah.
We've recently had a sports psychologist reach out to us, which would be great for the mental health side of the impact of injuries. It's just about having those connections so we can go, right, it's all under one roof, but if it isn't, we know someone who can sort it. That's the plan. Anyway.
It's good. Now, what I love, if you don't mind me saying, is you're on here as a company, but what you're not doing is you're not selling the company. What you're selling is how you can help people and what you can do. But I get that passion from you both over anything else. The way you spoke about your time and how you want to give back, the excitement it's brought yourself by able to be a part of this as well. And taking something which you've gone through with the premature birth of your daughter, and it's how you've used that to focus to go, look, we're going to use this, like say, a legacy.
Yeah.
That is something else then that it's an extra drive, you know. And it's so raw to hear, you know.
Yeah. No, it's amazing. Like, it's just so excited for people to hear more about it and see the process. And
I think that's what I'm most excited about is people seeing, like, I know how hard George works. I know how hard the other therapists work. And I know sort of, this is probably the nicest I've been to in a while.
Yeah.
Cool, here we go. I'll clip this and send it to you.
But like over the years and how he talks about his work, like he talks about it 24/7. He does it 24/7. Like, I know it's going to work because I know how good the guys are. And that may sound really cocky.
No.
It's not at all.
I'm more excited to show everyone what we can do and what we can make from this. And I think that's the most important part for me, is being like just sort of standing back and being like,
no, it's lovely.
I knew we could do it because it will be good. And I can say that I wouldn't have quit the job.
If you don't believe in it, then how do you expect everyone to believe in it, you know?
Yeah.
Like you say, you just mentioned there, you've got 3 people working for yourself. Just want to name check them. So you've got people behind the scenes, people, the physios working for yourself?
Yes, we've got 2 other sports therapists. So we've got Aaron and we've got Maddie. So Aaron works with us Monday to Wednesday. Maddie works with us on Fridays and Saturdays. And we've got Michael, who is our physiotherapist. So slight change. And he is works with us on Thursdays and Sundays. They've
7 days a week then?
Yeah, so we are open 7 days a week. George does Monday to Friday, and then between the 3 of them, they will cover the 7 days.
Sounds like it's such a good team.
Sounds
good
brilliant,
team, good setup.
It's a good team. They've all had experience in football as well. They're all big fans of football, which sort of then further spurred George on to go, actually, these are sort of like-minded people when it comes to the sport, to bring it back into to football. I know Maddie spent some time at Oxford United during her master's year. So we've got some clever eggs on our team. I know Michael and Aaron have also spent time with other football clubs as well. So it's nice that
you bring all that knowledge together, and you've got the guru here going, I've got this.
Exactly. It's nice also to have a female therapist as well, and because it is a male dominated environment, and so it's quite nice to have a female sort of making her way in that industry as well. And quite a lot of times it is that awkwardness when you are a female, like, I've got to go and see a male therapist. I don't know how I'm going to be, but then once you're in, that you sort of relax a little bit. But just knowing you've got the option of male and female therapists as well, and they're all, we've been really lucky with sourcing them, and they've sort of open to learn. They pick George's brain all the time,
which you don't mind.
You
understand.
Like they're adapting to sort of George's way of working, because it's something that he's done for years and we know it works, because everywhere will do it differently. They would have had experience in different placements, different clinics, and they all do it slightly different. So So yeah, we've got a good little team going on, haven't we?
Exciting, isn't it?
No, so exciting.
So then, one final question: then, where do you hope to see the business in 5 years? Have you got a 5-year goal? Have you got plans? 2, 3, 4 other centres?
Yeah, so we do have goals. So we would like to. First plan would be to go one step. We get it working, get it successful, and then go one step bigger. So the same, we just move to a new location.
Yes.
Right. And then after that, then it would be the goal to put them in different places around the country, because then they're everywhere. So then everyone can go, and
it becomes a brand.
It does.
George Gore brand.
We're in a position, we've set it up so it has the potential to franchise, and once we've sort of got something that we know is working, like we can make the mistakes at this level.
Yeah, of course, yeah.
Everyone makes mistakes.
It's learning. It's all learning.
Yeah.
I'm still doing it now. I'm still doing it today. Yeah.
So yeah, it's got the potential to really sort of go far, and
Brilliant.
sort of, I'd say 5-year plan is definitely next step would be
So inspiring to hear that.
It's massive, and what we're going to do is we're going to keep this episode aside. So when you make it big, we can go. Look, this is where it started.
Yeah.
They got some information from us. I thought, we'll kick on with that. The pod must have given it. Listen, we can't thank you enough for coming on. I've learned so much today.
So much.
I've probably learned more today than I ever did in school, if I'm honest with you. But that's because I'm here. I wasn't skipping school. But like I say, please give the sports therapist a follow. Just one more time. What was it called? The Instagram page?
It's George Gore _sports therapy.
George Gore _sports therapy. We'll tag you at the bottom, okay? And again, guys, like we say, please, when these videos come out, click like, click subscribe, because Rebecca, our producer, says the more chance we do that, the more chance we have of getting sponsors. I'm not a businessman. I just talk for a living. So, listen, thank you very much, George, Sean.
Thanks
It's been
so
a
much
real
for
pleasure.
coming on.
I've been Blaine Conway.
I've been Danny Parsons.
Bosh.